more importantly, you also get this 20% increase in myonuclei. So focus on that one for a minute, because the myonuclei means nutrition. There's ongoing nutrition for the muscle. Isn't it great if you can improve muscle nutrition and oxygenation? Because that fuels our growth for anything in organisms. And then other than the 20%, you then get this improvement in collagen. We all want that tightening. But look at elastin production. So that is the stretchy protein. Collagen is thickening. Elastin is the stretch. All of our patients pull at their skin all the time. Wouldn't it be great to stimulate up to 129% of elastin production? So I will combine this with topicals and therapies and study the results after 1 year. And this is a patient who had the 4 treatments, no maintenance, maybe 1 at 6 months, and that's her at 1 year. So we proved that it did work. So this is the eye applicator now, the icing on the cake. And it is radio frequency all the way around. We'll show you the applicators at the stand. But it only has the hyphas in the inferior border, just the inferior border. And I'm going to tell you why. Because the upper border of the orbicularis is a depressor. So we don't want to target eye bags. The patients love it. We're getting our results continuously, time and time again. All ages, all skin type. The patients loved it so much. In our 3 months of our study, normally I find these hard to get off the ground, patient recruitment for study. Everybody signed up to this. I had to call BTL and say, please get me more applicators. We sold out in 15 patients just after 2 days. It had never happened before. But I love to treatment blend. You know, I don't just treat one area. You can, but I love to blend it with the forehead. I love to blend it with the eyes, because then you get this resting elevation, which is really beautiful. I love to blend it with the cheek, because then we can target the SMAS with the target of the risorius and the submental area. We get this beautiful restoration of the cervicomental angle. So I want you to take home this message. Don't just think of the muscle in isolation, sliding along. Because in order for us to lift the cheek and to show others that we're smiling, we're all connected by connective tissue. So think of the British bacon, lettuce, tomato sandwich with the 3 layers of bread in between, and you've got butter that's connecting it. And the whole thing is unfortunately detaching as we age, and we need to kind of put the BLT back on its place. Those of you who don't know BLT, come and find me. So there's a displacement of connective tissue that goes on. So this is a treatment of connective tissue. It's beyond the muscle. It's the skin, the connective tissue, the muscle, the connective tissue, pulling it back to the bone, and then I use my fillers to pin it back into place. But you look at the natural revolumization, the natural restoration, because we're targeting zygomaticus major as well, which pulls the transverse facial septum up, restoring the lip-cheek junction. Patients who are going to go through surgery are now not needing to, and they can come and have this treatment really quickly. Patients who have already had fillers before, now needing correction in their older years, are able to come and have this treatment with me, as well as autologous facial fillers using PRP derma filler, and they are safe. We know about muscle aging in the body. We can see it in our elders, and we can see it in our grandparents. We know we lose 1% every single year, sometimes faster.